Welcome to Anatomy Coloring Book, page 24. This is Dr. Stephen Harkins. The temporal mandibular joint, also known as the craniomandibular joint. First, let's review the temporal bone, one of the cranial bones, or temporal bone, with the mastoid process here, the external auditory canal, the styloid process, the zygomatic process, and recalling that there are two separate temporal bones, one on each side of the skull. Here we have it again. Temporal bone, styloid process, the external auditory meatus, the zygomatic process, and that's the temporal bone. This is the bone where the fossa lies, the articular fossa right here of the temporal mandibular joint. It's the portion of the joint that belongs to the temporal bone. The mandible will articulate here. The mandible will articulate with the temporal bone, the articular fossa of the temporal bone. And this is the condylar process of the mandible. And it has hyaline cartilage, or it has cartilage, slippery cartilage on the surface, as does the articular fossa. You want to have in all your joint spaces. It is a synovial joint, so there's synovial fluid inside there, and you want it to have be very slippery. You want the surface to be very slippery. So the condylar process, actually right here, yes, oops, is going to go into the articular fossa. And the condylar process, let's make it this new color here. The condylar process. And of course, the articular cartilage articular slippery cartilage on top of the condylar process and on the surface of the articular fossa. Let's use another color, why not, for the articular cartilage here and here. Of course, this is the mandible, the coronoid process of the mandible here. The joint is covered by a joint capsule, a collection of ligaments and structures that surround the temporomandibular joint. It is diagrammed here. It's the surrounding structure, keeping it nice and tight and snug in there, and keeping the synovial fluid inside. The articular capsule, found in all synovial joints. Surrounding, enveloping the entire temporal mandibular joint. Of course, it's cut away here, and so where you can see the inside, and the piece of the mandible is cut away too. The process of the mandible here, condylar process. And here, condylar process of the mandible, surrounded by the articular capsule. And the slippery articular cartilage here on top of the condyle. On top of the condyle. These are mouth open and mouth closed. Here's your hyaline cartilage again, right up next to the bone of the temporal fossa, the articular fossa of the temporal bone. And looks the temporal bone in red here. The synovial cavity is the space that is encapsulated by the joint capsule. It contains synovial fluid. This is in yellow here, the superior joint space of the synovial cavity. And down here, the inferior joint space of the synovial cavity, all the way down into here. The inferior. And what is separating the inferior and the superior joint space? So that's a synovial cavity. Superior and inferior joint space. What is separating them is what's known as the articular disc. There is a disc. That's right, your jaw actually has a disc in it. And this is your articular disc. In front, we have the anterior band of the articular disc, and back, or in the middle there, where you have the posterior band. The articular disc has an anterior band and a posterior band. Here's the anterior band and the posterior band. And then behind it, what is known as the retrodiscal pad. Retrodiscal pad. Retro means behind, discal means disc. The pad that's behind the disc. That's the retrodiscal pad. The articular disc is connected to the lateral pterygoid muscles. It's one of your jaw muscles here. And you can see it reaches in here and grabs the anterior portion of the disc. And is involved in bringing that articular disc forward when opening the mouth. This is mouth open. This is mouth closed. You can see that anterior movement or translation of the disc when the mouth opens. There is also a lateral ligament stabilizing the side of the jaw. And it's cut here. It's cut here, revealing the ligaments behind it, the joint capsule underneath it here. And also, the stylomandibular ligament coming off the styloid process and attaching to the mandible. The stylomandibular ligament. So it's creating yet another connection from the temporal bone to the mandibular bone. And just to review, when the mouth is open, the condyle moves forward. And when the mouth is closed, the condyle moves back into the retrodiscal space along the retrodiscal fat pad. And the disc, articular disc, moves forward with the mouth open along with the condyle, and then back as the condyle closes, as the mouth closes. This represents page 24 of Anatomy Coloring Book. This is Dr. Stephen Harkins.